Hi, I am CJ Devgan, and welcome to another edition of Breaking Barriers, where my goal is to provide you with proven tools to help you transform your business. We are living in times where business, as usual, is not sustainable. Because new disruptors are arriving every day, therefore, you too must reinvent and break barriers that are holding you back. If you are struggling to grow your business, check out my website at cjdevgan.com and learn about my consulting and coaching services, and let's talk.
Hello and welcome to another episode of Breaking Barriers. And in this episode, we will continue our conversation from the last week with my guest, Dr. Ghadir. Dr. Ghadir is a director at IQVIA Peer Provider Government Management Consulting and an external advisor at the Executive Office for Organizational Transformation, Dubai Health Authority.
What do you see as the major challenges? I know we are going through this pandemic, so ignore COVID for now. But outside of COVID, what are the major challenges that the health system in UAE is encountering? Now, for example, in Canada, we have three or four big challenges. We have aging population. That's number one. Our wait times are very long these days. That's a second issue. And we have shortage of providers, doctors, nurses, other ancillary clinicians. We are having these three, if I have to mark three big challenges, those are. And then the cost of healthcare as a whole is going up. So those, to me, are the biggest challenges that are uh, impacting so we have to find solutions to these challenges quickly. So what are the challenges on your side?
Sure. So the cost of healthcare is always number one challenge, right? The rising cost of healthcare, number one. Even though there are obviously 3.3% of the GDP is spent on healthcare in the UAE, maybe there is room to actually spend a little bit more. However, the expenditure is actually growing. So optimization, the need for optimization and waste removal is there. Number two is actually workforce, specifically local workforce. I mean, again, a very important imperative is to expand the healthcare workforce enablement and development in the region, because most of the workforce actually in the UAE come from international source countries, right? Whether it's from the west or the east. We are now, with the pandemic, we are realizing the importance of bringing medical education to the extent of being able to fill in the gap locally from the citizens and the residents alike. That's number two challenge, which is again one of the biggest pain points or initiatives that needs to be addressed. Number three, obviously, the need for automation and integration. The silos, as you have it in Canada, where each province has a healthcare agency, has created a lot of process silos. And here in the UAE, each state or each emirate has its own healthcare ecosystem. And obviously, for example, if you're a physician in the UAE, you would require to obtain a license in each and every jurisdiction to practice. Again, the need for integration, the need to eliminate silos and integrate more is number three top priority. So digitize everywhere, specifically areas from looking at electronic medical record work that has been done. And there's a lot of great work that has been done in the Emirate of Abu Dhabi, where they have digitized all the public sector facilities. In Abu Dhabi, the Dubai Health Authority has done the same, and now trying to create an integrated health information exchange, as well as the Northern Emirates. So there are multiple programs that have come to digitize the public sector. The next part is to integrate the public sector with the private sector digitally, and this is one of the biggest initiatives. So creating integration hubs and eliminating silos. That's the third. So these are the top three I can think of, from the rising cost to the lack of workforce within the localities, to the silos and the need for integration.
Absolutely. I think the number 1 and 3 are interconnected because more integration you do, less waste is there in the system. Because what we all have experienced that if healthcare systems are not integrated between providers, then if you go to provider A and then you go to provider B, then the provider B, given we are in the world of evidence-based medicine, they will run the same test on you, which is causing more waste of resources. As well as by integrating, you can provide care to patients in a lower cost setting rather than in an acute care setting. So, and third, I believe by integrating healthcare, knowing what the population health is like, you can keep them healthy, right? So, for example, if I'm a diabetic and you know what my sugar levels are, and if I'm taking those tests, if that Internet of Things is communicating directly with my health record system, and that health record system is being communicated and managed by like a network command center, like we used to have in big IT firms, where they see alerts and they say, okay, I need to talk to this patient. Their uh, glucose levels have gone up over a period of days. What are they not doing? Are they not taking the meds? Are they not exercising? Whatnot? So we can do more proactive and preemptive care for our patients to keep them healthy and out of health systems. So on that subject, so I know we spoke about it that the providers per se are mostly private as well as public healthcare, right? And you mentioned that in public side there is big health information exchanges being built, so the data can be transmitted across. Are these health exchanges point to point or hub and spoke, which means do they hold patients' data in their servers or they just let it go from hospital A to hospital B? They don't retain anything.
So the idea is to actually use the, I believe, hub and spoke, right? So
Yeah.
I think without any footprint left or retention. Again, at the moment, the actual there are 3 health information exchange initiatives that have been going. The most mature one is the one in Abu Dhabi. It's called Malafi. Basically, they've reached 85% connectivity, interconnectedness within the Emirate of Abu Dhabi between public to private. And I believe it's actually doing the, if I'm not, point to point is actually the one you're referring to, right?
The point to point is where there's no footprint, data comes and
No
goes.
footprint.
There's
Correct.
nothing being
Correct.
stored. Whereas
Correct.
a hub and spoke, you keep the data. Only when another provider sees you, they say, okay, do you have any information on Mazin? And then the hub will say, okay, yeah, I do have data on Mazin. Here is the data.
Yeah, I think that's the spine model in the UK where they wanted to do the hub and spoke. I remember. It's fine. Okay. So I believe, and again, I might be wrong, but I believe the one in Abu Dhabi or the Health Information Exchange that has been the most mature in the region has achieved 85% interconnectedness already across the private and public sector is the point to point. If I'm not wrong, I will have to find out. But hopefully that's the case. However, the one in Dubai and the Ministry of Health and Prevention, there is one program called the NABIT program. It's still in the implementation stage, an early stage of implementation. They went live, I think, with a pilot last November, and they've connected one of the major private sector facilities and the Dubai Health Authority through, I think, point to point. The Ministry of Health and Prevention, they are still haven't launched the pilot yet, and I believe they are working towards that. It's a program called Riayati, which is also trying to connect the private and public sector. However, the Ministry of Health and Prevention is the federal program. So eventually Abu Dhabi and Dubai will connect to the Ministry of Health and Prevention. That's the idea, that both Malafi and Nabid will connect to Riayati.
So help me understand, what are the biggest challenges? Because on my experiences with health information exchanges that I have worked with and consulted for, the 2 or 3 biggest challenges. Number one is how do you identify a person, right? Because in even though we have OHIP, In US, there is no single identifier for a patient. So you don't know if this patient is truly that patient. CJ is CJ, right? So that's one of the biggest challenge. And second is interoperability of data, which means a gender could be male, female, gender could be 1, 0, could be M and F, and that's the most easiest of things. But once you go into more complicated codes, things could be done codified very differently. So how to standardize the coding of your system so the meaning doesn't get lost in translation.
So absolutely. So I think what happened in the last many years is that they've been working across the different emirates in the UAE on the standardization of coding, because what happened is the financial services integration platforms were rolled out first, right? That helped getting the standardization into place at the beginning. I would think that that has prepared what you call the environment to allow more substantial development for the health information exchange. So, for example, the e-claim platform in the Emirate of Dubai is our financial services integration engine that has managed to build a transactional platform connecting payers and providers in the Emirates of Dubai almost 9 years ago. It started 9 years ago. Abu Dhabi did it also many years ago. And that facilitates the fact that you need to get your ICD-10 or ICD-9s up to standard, make sure that everybody submits the data in a unified fashion, make sure that your CPTs, your ICDs, your HCPCS, and all the different coding mechanism. And that also was a byproduct of the DRG rollout that happened in Abu Dhabi in the first place, and then Dubai did it only recently. So again, these multiple initiatives that began, I mean, if I tell you when did the EMR implementation start in Abu Dhabi public sector facilities, it started sometime in 2006. That's when they started rolling out Cerner across the different facilities in Abu Dhabi. In the public sector. Dubai, they started rolling out Epic a few years ago. So that helped the standardization and the preparation for the digital maturity to then you bring in the health information exchange. Not forgetting the UAE healthcare data law that came up in 2019, enabling and allowing the Emirates to start rolling out the health information exchange with a unique data law that resembled our HIPAA or GDRP in the UAE, right? So that's a huge shift in the way how to handle data, and that facilitated, for example, the Abu Dhabi Malafi program to be rolled out in such a dynamic and speedy way, and followed by Dubai HIE program, and soon by Mohab HIE program. So again, the ground was prepared for such strides to be rolled out.
Excellent, excellent. I would love to continue our conversation, but I see we are at the top of the hour. And but if you are open, we can have another round of conversation, and we can talk more about how this data is actually going to be utilized to actually solve the 3 problems that we talked about, right? So this information exchanges are great. So now we have them talking, but what trend line have you seen so far with the implementations? But more importantly, that preventive care, that population health we talked about, data, as people say, is new oil. How is that data actually being utilized? So no, I really, really appreciate your time. I know it is Friday evening in Dubai, and you taking time out of your busy schedule and sharing with our audiences your experiences. Thank you so much.
No, thank you so much. It's a pleasure, actually, Shiranjeev, to actually know you, get to speak to you. More than happy to jump on another call for sharing some of the journey that I've experienced in this wonderful land of the UAE.
Thank you, my friend. Enjoy.
That is it for today. Thank you for listening. Let's go out and break barriers and generate new possibilities. Please be sure to visit our website at cjdevgan.com. And if you like our show, please subscribe, leave a rating and a review for us on iTunes.